Welcome to the 10th edition of Our Take. Can't believe we've already done 10 of these.
I know, double digits.
Wow. Today we're going to talk about Medicare. I guess more to the point, Michelle's going to talk about Medicare. I have to listen since I am turning 65 this year, so it's directly applicable to me, as well as quite a few of you that'll be turning 65 over the course of the next several years, and some of you that already are over 65 where you're looking to make some changes. So without further ado, Michelle.
Thank you so much. Hello and welcome. So as Ken mentioned, today we're going to talk about Medicare 101, the when, why, and how. We'll keep it brief, but just wanted to give you some of the highlights. So first of all, who's eligible? As Ken mentioned, once you turn 65 years old, you are eligible for Medicare. Or if you're under 65 and you qualify on the basis of a disability or other special situation. There are 4 parts of Medicare. We call them the A, B, C's, and D of Medicare. There's Part A, which gives you the inpatient hospitalization, skilled nursing care. Part B is for doctor visits and outpatient care. Part C is your Medicare Advantage, and Part D is prescription coverage. When do you enroll? So there's 4 different enrollment periods. The initial enrollment period, called the IEP, is the month of your birth date. It's 7 months long, so it includes the month of your birth date, as well as 3 months prior to your birth date and 3 months after your birth date. You may enroll in Part A, B, or both during this time period, and you may choose to join a Medicare Advantage plan, which is that Part C, or a prescription drug plan, which is Part D. And oftentimes the Part D and C will be included in your private insurance, your Medicare Advantage plan. There's the annual enrollment period, which actually starts today. We're filming this on October 15th. The annual enrollment period, which is the AEP, that starts October 15th and it runs through December 7th. So for anybody who is already enrolled in Medicare or who wants to change their Medicare enrollment, this is the time that you'll want to do that. During enrollment, the annual enrollment period, you can add, drop, or switch your Medicare coverage. Then there's the Medicare Advantage open enrollment period, and that's January 1st through March 31st. So if you chose a Medicare Advantage plan and you're finding that at the beginning of the year you're not quite pleased with it, it's not giving you the coverage that you expected, you can change your Medicare Advantage plan. As a Medicare Advantage plan member, you may disenroll from your current plan and switch to a different Medicare Advantage plan one time only during this period. And then there's a special enrollment period, and this is for special circumstances, and there's no specific date on this. It's only for people who meet certain specific criteria. So for example, if you retire or you lose your employer coverage, you move out of your plan service area, or if you just need some extra help. So there's various costs involved in Medicare. For most, the Part A, which is the inpatient hospital care, that is going to be, there's going to be no premium to you for most people, but however, there is a deductible. For 2020, it's a little over $1,400. For Part B, the monthly premium is $144.60, but for individuals making more than $87,000 or for couples earning more than $174,000 annually, you'll pay a little bit more. And your premiums are always based on your income 2 years prior. So for 2020, your premiums paid in 2020, you're looking at your 2018 income. And you'll want to look at, if you're over those limits, you're going to want to look at what's called the IRMA table, and we're going to go into that a little bit later. Part C is the Medicare Advantage plans, and those tend to cost less than traditional Medicare. There are deductibles and copays and out-of-pocket costs that can add up with the traditional Medicare. So you'll want to take a look at your Medicare Advantage plans depending on what kind of needs you have. And then Part D is for prescription drugs, and that's purchased through private insurance companies, and the costs vary, and again, you'll want to really take a close look at the medications you currently have. So Medicare has some very strict rules, and it's important to know exactly what those are so that you can avoid any costly errors. So for example, if you miss the deadline, you'll be subject to a 10% penalty of your Part B premium for every 12 months that you missed. So an example of this is if you miss 2 years, you'll pay a 20% penalty, but what's even worse is that those penalties will continue for life. Not enrolling in a prescription plan, which is the Part D, which is a common mistake if you don't enroll in a plan because at the time you're not taking any medications, although you may not need them at the moment, you still need to review your options because Medicare calculates the late enrollment penalty by multiplying 1% penalty rate of the national base beneficiary premium, which is $32.74 in 2020, by the number of full uncovered months you were eligible to enroll in a Medicare prescription drug plan, but you did not. This can really add up. Just as Part B, the penalty is for life. There's also the guaranteed issue right, and this requires insurance companies to offer certain policies even if you have a pre-existing condition. However, if you fail to enroll in Medicare past 63 days of losing private insurance health coverage, you can lose this right. So it's really important to take a look at those deadlines and to know the rules. So as we mentioned, it's important to review your Medicare coverage every single year. Even if you've been on Medicare for years, you still should review your coverage and review your prescriptions. It's especially important to review your plan options because changes happen year to year. We worked with a couple who had vastly different medication lists. By working with our specialists and viewing their options, they were able to project prescription savings of literally thousands of dollars each year. Not only do plans change, but your prescriptions change. And it's important to be sure that your medications are on what's called the drug formulary list. This is the list of covered drugs for your particular prescription plan. If it's not, you'll have to pay out-of-pocket expenses until your next enrollment period. And it's important to review this every year. Understand your Medicare surcharges. This is what I referred to earlier as the IRMA bracket. IRMA is the Medicare income related monthly adjustment amount. So your Part B premiums are based on your modified adjusted gross income 2 years prior, and IRMA is an amount that you may pay in addition to your Part B premium if your income is above a certain level. The Social Security Administration sets 4 different income brackets that determine you and your spouse's IRMA. And we had a client that was married to a younger spouse that was still working. And we suggested that the client eligible for Medicare go on his wife's group plan and suspend his Medicare Part B coverage to avoid the cost of Medicare because of where they stood in their IRMA bracket. Now, this may not work for everybody. There's different rules. Again, there's very strict rules. Because his wife worked for a company that had greater than 20 employees, he was able to suspend his Part B coverage. There's a different circumstance if you work for an employer with less than 20. But as with everything, there's caveats, like I mentioned, and this strategy worked for them, but we're here to talk to our clients for different strategies that may work best for them. Capital gains also impact your Medicare surcharges. So when you're talking about income, you also want to take a look at cap gains, either from the sale of securities or real estate that can affect your costs, and they will bump you into a new IRMA bracket. This is why we look at our clients' tax returns to see how much capital gains we can take without bumping them into a higher IRMA bracket, or conversely, using a strategy whereby we see if we can do a Roth conversion while they are in a lower tax bracket before they start taking required minimum distributions, which may bump them into a higher IRMA bracket. We also have various resources available to help you in making your decisions regarding Medicare. You can download our simple 3-step Medicare guide from our website or our YouTube channel. You can also give us a call to discuss your specific situation. If we're unable to answer your question, we've partnered with Medicare specialists to answer your questions, and there's no charge for our clients for this service. Or you can always visit medicare.gov for more information. So I know we went over this pretty fast, but we just thought it was important to go over the highlights, especially since we are currently now in the annual enrollment period. If you have any questions, please reach out to us. We hope you have found this information helpful, and we look forward to speaking with you soon. Take care.
Very good. Thank you.